Hello everyone, Professor D here, and this week we'll be talking about the cardiovascular system and cardiovascular health and disease. This is a very important module and one of the first ones where we will really be going into detail into some of the anatomy and physiology, which is important, and one of the essential objectives for this course is to understand a little bit of the anatomical and physiological aspect of the cardiovascular system so that we can further understand the importance of maintaining health and balance in that cardiovascular system. So first, what is the cardiovascular system? We may have heard this term before, and we want to make sure we understand that comprises of the heart and the blood vessels, so the arteries and the veins that allow the blood to flow throughout the body. We've spoken previously about the importance of movement, and certainly the cardiovascular system was one of those major systems that we discussed, movement of the blood and nutrients and oxygen and waste materials throughout the body. So it's very important to understand what we're talking about there. Other organ systems throughout the body do have an influence on the cardiovascular system. So some to discuss are the digestive system. The heart would be pumping blood that didn't have any nutrients in it if it weren't for the digestive system being able to put nutrients from our food that we eat into the bloodstream to go throughout the body and get to the different tissues that require the new nutrients. The respiratory system, we've talked about that being another system that really influences movement, and with that we have the ability of it to bring in oxygen to the blood, and then the heart's able to pump the blood throughout the body to bring fresh oxygen to those new organs that need that, and then also take the carbon dioxide back to the lungs and then exhale it, get rid of it. Again, we've talked about we have to be able to eliminate waste, and the same is true in the blood system. And one way to eliminate gas waste is to have that respiratory system pick up the carbon dioxide from the blood and remove it by exhaling. So that's important to understand. And that also maintains the correct acidity of our blood. Our blood's very specific. The pH, we may have heard that term before, that has to be very, very specific. It's a narrow range. So the respiratory system is one of the two systems that allows the homeostasis of the pH of our blood. And then the endocrine system, which is the system that creates all the hormones for the body. That's very important to understand because, as we learned last week in this stress lecture, the hormones can regulate the speed of the cardiovascular system. So it's important to understand that if our heartbeat is elevated or our blood pressure is elevated, it's likely due to a hormone imbalance or maybe a short-term hormone change due to some sort of stress that we're undergoing. So we want to remind ourselves that the cardiovascular system doesn't occur all by itself. It does have other influences that are important to understand. Let's talk a little bit about what the heart does specifically. So the blood that has finished up in the tissues throughout the body returns or visits the heart through the veins. There it is very poorly oxygenated because the tissues already use the oxygen up and it's returning a lot of carbon dioxide to the heart. And that's in the right side of the heart that's poorly oxygenated. The right side of the heart then pumps that blood to the respiratory system, to the lungs. There, the lungs are able to exhale the carbon dioxide and the gases that are waste and inhale fresh oxygen. That fresh oxygen then goes to the left side of the heart. And from there, the left side of the heart pumps that highly oxygenated, oxygen-rich blood back to all those tissues, so they have fresh oxygen, and that cycle just continues continuously throughout life. So that's what's really important. That's what's happening with the heart, is it's acting as a pump. There are 4 valves in the heart that are really important because the valves, just like any valve, it allows flow to go one way, but then if it tries to come back, it stops it. And that's important so that you wind up with the right side of the heart remaining poorly oxygenated, because that's where the veins brought the already used blood back to the heart, and then the left side's oxygenated, allowing for there to be fresh oxygen going to the tissues throughout the blood. So it's really important throughout the body. And that's really important to maintain proper oxygenation throughout the body, that we have those valves. So really understand the importance of the valves in the heart in maintaining that one-way street, if you will. Next, I'd like to go over a few of the disorders, conditions, diseases of the heart that are important to understand here in Wellness for Life. So the first one is atherosclerosis. It's a big word, but we may have heard it described. We may not have heard the term before. But what happens here is there is a plaquing or a buildup of typically fat, cholesterol in the arteries. And why this is important to understand as being a problem is if this is the lumen or the opening of the artery, something is filling it up. So what happens is it makes the opening, the lumen, smaller. So now there's increased blood pressure through that area and a greater chance of damaging the blood vessel, and also decreasing the amount of fresh oxygen heading to whatever organ that artery goes to. So it's really important to understand that. Arteriosclerosis is another item that affects the blood vessel wall, and it's decreasing the elasticity. So it's not able to stretch and bounce back as well with every single beat of the heart and the blood pressure. It's becoming more stiff. So now there is a greater resistance. Again, it can increase blood pressure and increase the risk of there being some sort of a rupture of the blood vessel. So that's really important to understand. And oftentimes atherosclerosis and arteriosclerosis will occur together. So then they compound the concerns of that individual. So that's something to be aware of. Coronary artery disease, or CAD, occurs from atherosclerosis and arteriosclerosis in the coronary arteries. The coronary arteries are the arteries that supply the heart muscle, the myocardium, with blood. We want to understand that the blood passing through the heart chambers and the valves, that's not the blood that specifically is feeding the heart muscle. That's taking it from the aorta, which is the largest artery that comes right off the heart, just like every other organ. So it does have to wait for the heart to pump itself to get the blood through the coronary arteries. So if there's some sort of limitation of blood flow through the coronary arteries, there can be some damage to the myocardium, that heart muscle. We want to know another term called ischemia, and that means a restriction of blood flow. Coronary heart disease is the damage of the myocardium as a result of insufficient blood supply. The next term we hear about a lot in our society, and that's myocardial infarction. We more commonly hear this described as a heart attack. And what's happening here is myocardial infarction is saying that there is damage to the heart muscle, to that myocardium. And typically the damage is permanent. And this occurs due to a complete blockage of one or more of the coronary arteries. We may have seen or heard of the signs of symptoms in movies, television shows, or maybe have witnessed it ourselves or know someone that has had a heart attack. And they can be different from person to person, but in general, many times there's this crushing feeling in the chest, like an elephant sitting on the chest. A lot of people will describe that. A lot of times, a lot of pain and burning into the left arm, maybe up to the jaw a little bit. The back shoulder blade can be very common. Oftentimes left side, not always. So we want to understand some people, more commonly women, present differently, but I have had male patients that presented differently where maybe it's the right arm that feels burning to them. Maybe they have intense indigestion, acid reflux feeling, or some lower back pain can occur as well in individuals. More commonly women, but again, some men do present differently. So we need to understand that it isn't always going to be that theatrical that we see in the movies and in the television shows. Sometimes it's more subtle for people, and we need to pick up on those hints and make sure that they go to the hospital as soon as possible and have that checked out. What often happens, we may hear of a coronary bypass surgery. So what's happening is they're going in and taking usually like the greater saphenous vein from the leg, a vein that we could work without, and they take that and then they go over the coronary artery that's been blocked. So there's really no ability to, at that point, free up that artery. The tissue that it supplies is damaged, so we want to go from healthy tissue to healthy tissue and bypass that damaged tissue in the heart. And that's what a coronary bypass surgery does. And if you hear that someone has a double or triple bypass, that means they had 2 or 3 or more coronary arteries that were blocked and they had to pass over them to maintain proper blood supply to the rest of the myocardium. Angina pectoris is another term we want to know, and what that is that crushing pain and difficulty breathing similar to a myocardial infarction. However, it happens for only a few minutes and the patient recovers. What that means is there is a restriction of blood flow, and you really need to have that person go to a cardiologist immediately, because it's telling you there is a problem. It's not as bad as having a heart attack yet, but it's getting there. The problem is a lot of people, when we have these symptoms, we think, oh my gosh, I'm having a heart attack, I need to go to the doctors, and then it goes away in 3 minutes, so then we say, oh, never mind, I'm going to work. They need to realize that is a warning of the sign of the body and that they need to go seek help immediately. Another thing that we hear about a lot is the cerebrovascular accident, more commonly described as a stroke. What's happening here is we are having a blockage of an artery that goes to the brain, so decreased blood flow to the brain. And with only 3 to 5 minutes of decreased oxygen levels in the brain can lead to permanent brain damage, and it can also lead to deficits. So that's what's happening with a stroke. And you may see someone that had a stroke, they have a problem using one side of their body, maybe their face droops a little bit more now, or the hand doesn't work as well, or they have a hard time walking, and that's because there's permanent damage in those areas of the brain that control those functions. Similar to that is a transient ischemic attack. So transient means come and going. Ischemia, we know, is a decrease in blood flow, and that's also abbreviated sometimes as a TIA. And that is, again, no permanent damage, but it seems similar in signs and symptoms to a stroke, only it happens for a few minutes and there's no permanent damage. Again, this is a warning sign of the body, and the people need to go see a neurologist immediately. Again, as with angina pectoris, sometimes people have these symptoms, they panic and think, I'm having a stroke, I need to go to the emergency department. And then they stop in 2 to 3 minutes and they say, never mind, let's go to work or continue about my day. They really need to go see a neurologist, because that means that a stroke is likely to happen if they don't get some help. If you think someone is having a stroke or even a TIA, you need to follow some protocols to help them, because oftentimes they might not be able to communicate. And the abbreviation of that is FAST, F-A-S-T. So the first thing you want to do is ask them to smile. If they're not able to have both sides smile equally, if one of them is drooping, then that indicates to you something might be wrong with the blood flow in that area. Arms, ask them to raise both arms up. If they're unable to do one side, likely it's usually one side, then that's an indication that they need some help. Speech, ask them to say whatever sentence comes to your mind and see if they can do that. And if it's very gargled, or they just look at you and they bug eye and they just can't, then you definitely need to go to the last one, which is time. So you kind of want to keep track of how long it's been happening, because again, we only can sustain about not even 3 minutes really. We want fewer than 3 minutes of decreased oxygen to the brain before they'll be damaged. So it might be helpful for the neurologist to know how long these symptoms occurred. But the big thing of time is get help now, because time is of the essence. So call 911 for them if they have one or more of those symptoms being positive, meaning they're not able to do them as they should. I have known people that they oftentimes have a massive headache when they're having a stroke or TIA as well. So if they mention to you they're having the worst headache of their life, and then all of a sudden they're unable to speak or unable to do things or something, that's an indication that they need some help. I do know an individual, she woke up with the worst headache of her life. She managed to drive to work, and then she didn't think she could make it to work, so she went to tell her boss that she had a really bad headache, thought she needed to go home, and she couldn't communicate to her boss. She thought she was saying the words, but her boss said she was just jumbling words, and that's when her boss knew she needed to get her help, so she did. So please make sure you take some time this week, because cardiovascular health and disease and indicators are something that we will definitely know people throughout our lives that have these, and it's really important to know the signs and symptoms so we can help them seek to help as soon as possible. I hope you enjoyed this video and have a great week.